Good morning and welcome. I take great pleasure in hosting this historic occasion, the official opening ceremony of the new acute care wing, paving the way for when our doors open to the public on Sunday, September 14th. It represents the work of countless individuals, from people outside of BHB, including construction workers, international and local advisors, board members, past and present, civil servants, ministers, and premiers, to a multitude of employees, both Bermudian and from overseas. Special mention also has to be made to recognize and to thank our neighbors who have lived with Bermuda's largest construction project on their doorstep for the last 4 years.
Bermuda Hospital's board's CEO, Vanetta Simons, made that address a little over a year ago on September 10, 2014. And at 1 minute past midnight, Sunday, September 14th, the new wing opened its doors to patients for the first time with the move of the emergency department. The first patient came in a few minutes after 2 a.m. After years of meticulous planning, the big move, transferring patients from their wards in the old wing to the acute care wing, came later that day.
We've been planning this for 2 years, and all of the teams have pulled together to get the work done. So we've had move coordinators, and we've been meeting the move coordinators for over a year in preparation for this weekend. So what we did is they all had all of the labels on all of the boxes, and we moved everything across very smoothly. They were all prepared, so prepared.
It's so exciting. We're having a busy, wonderful, well-organized day. Lots of planning is now coming to fruition, and actual patients have started to move over, and everything's going well.
I'm so excited about it. I've been here long, and this to me is one of the most exciting times for me.
Today it's been exciting, it's been busy. We just brought patients over, transferring patients over. So hopefully it's been going smooth, and hopefully it continues to go smooth.
How about the staff?
Excited. Lots of coming in on the day off to help, and everybody's just working together.
Staff have been tremendously helpful. They've done things outside of their scope. Everybody's just kicked in to make this happen.
The move has gone very smoothly. We should be very proud of ourselves.
It's awesome. I think it's just going to be great working in a beautiful environment for ourselves. You know, not only are the patients going to love it, but I think we're going to enjoy working there as well, because an experience like this only happens once in a lifetime. Most of us have never worked in a brand new facility, so you know, it's been an awesome experience.
After all the hard work and effort that's gone into the design and building of this wonderful new acute care wing, and to be there when the doors opened and for it to at that moment turn into a hospital was just so special.
We've had every aspect of healthcare worker, non-healthcare workers, community, neighbors, everybody, and it's been a project that has been great buy-in, and I think everybody needs to be proud.
One of my staff just said to me, and I think that sums it all up, she says, even my eyes are smiling today.
The patients are very excited to be the first patients in the new acute care wing of King Edward Hospital.
I think they might be a little bit overwhelmed to see everybody being busy. Those who thought they were going home before, there's a few that had to stay, and so they're all happy coming in and being the first.
They are excited. The ones that are able to speak to us, they're happy with the room. They're ecstatic. They're just standing up to the window, looking out at the views, and otherwise they're in bed watching TV.
It was just like being in the regiment. Clockbuster. I was very impressed.
The patients are fantastic. One lady said that she would like to stay forever.
A year on, the enthusiasm and excitement of that first day may have waned somewhat, but staff are agreed that the benefits they touted then have improved service to the public.
The benefit of working in the acute care wing is that the 90 rooms are single rooms, and this should enhance the doctor-patient relationship. It will enhance confidentiality, We can also have family meetings, which are without breach of confidentiality.
It's great because we now have single rooms. That's the first thing. I think the fact that we no longer have to worry about cohorting patients who have various hospital-acquired infections. It's going to give patients their own privacy, so it gives the nurses a chance to actually interact with the patients and on a daily basis involve them in their care so that they have a plan of care every day, that they're working towards goals. That helps the nurses. We don't have to worry anymore about breaching confidentiality. If they want their family involved, we can do that. We want it to be patient-centered. So if they want their family to develop their plan, that's great as well. It should help us to get the patients in and out of the hospital quicker than we have traditionally been able to do so.
It's been an exciting first year. Of course, it was absolutely wonderful 1 year ago to be here when we transferred our patients from King Edward, the general wing, into the acute care wing. We set out to design and build a building that was good for our patients, first of all, and absolutely a perfect working environment for our staff, and that's what we've achieved. We wanted to reach international best practice standards for a build. We've maintained our accreditation, which completely says that we met those international standards. Our patients are very happy. The feedback is excellent, them being in those single patient rooms. But I think even more importantly, our clinicians feel that the space reflects the level of professionalism that they want to bring forward every single day. And I believe it's already contributing to the improvements we see in our quality results.
As we celebrate the first anniversary of the acute care wing opening, we remember how Bermuda's medical facilities developed from humble beginnings and involved countless committed individuals, both healthcare professionals and many who were not. In 1894, when Eldon Harvey opened the tiny cottage hospital, only 8 patients could be treated. Expansion soon began, with the first wing completed 2 years later and an operating room added at the turn of the century. Urgently needed isolation wards were finished soon thereafter. In 1920, a small facility opened on Point Finger Road, the site of the current hospital. Administered and maintained by the colonial government, it accommodated 32 patients and treated both surgical and medical cases on the same unit. As new technology developed and new equipment was purchased, greater diagnostic and therapeutic services were made available. By 1925, admissions for the year had risen to 681. By 1955, admissions had jumped to 3,424. The number of beds steadily increased to cope with demand, but it was not until 1965 when King Edward VII Memorial Hospital General Wing officially opened with 225 beds, furnished by generous donations from the public. In 1970, the government appointed the Bermuda Hospitals Board to govern both King Edward and St. Brandon's, which is now the Mid-Atlantic Wellness Institute. Healthcare needs, technology, and treatments constantly changed not only the services required, but the amount of space needed. More than 50 years since it opened, our hospital has constantly had to grow. Additions to King Edward from the 1980s included a new surgical wing, emergency department, dedicated hospice facility, intensive care unit, kitchen, storeroom, and pharmacy. Space was increased for laboratory, nursing, maternity ward, clinical dietitians, imaging services, fracture clinic, pink cafe, gift shop, and continuing care units.
Well, this is a 1960s building, and it certainly wasn't built to accommodate modern-day medical requirements. And so it would be very, very difficult to put up-to-date equipment in. The infrastructure just doesn't exist in terms of the electrical supplies, the openings to the room spaces, the actual spaces within the ceilings where you conceal and distribute a lot of the services. Just couldn't accommodate that kind of upgrade. You would have to build a new wing. It would be difficult to try to incorporate the upgrades to this hospital while it is occupied. And in fact, it's almost impossible to carry out extensive renovations to an existing hospital that's occupied by not well people.
Unfortunately, when infrastructure begins to deteriorate, lots of times that's invisible. It's invisible to the community, but it's very visible to those of us who have to work in the environment. We were really challenged when we experienced the 2 hurricanes back-to-back last year, just 2 months after we opened this acute care wing. And during those hurricanes, our continuing care building experienced really bad hurricane damage. We were able to move 40 patients from that area into vacant area within our general wing, and it is now scheduled for demolition. So we anticipated that we would need it. It was delivered, and immediately after we had the hurricanes, it just punctuated that fact that we did it just in time.
This is a new building. It has very complex engineering systems throughout, so it will not be without its issues. What we've seen in the first 12 months are real examples of some issues, clinical, non-clinical, whereby the nature of the contract has incentivized Black & McDonald as a facilities management services provider to respond to these issues and rectify them within the conditions of the contract. So yes, it's achieved real value for money, and it's a facility that Bermuda needs.
So the PPP project is a public-private partnership, and what that means is that BHB joined with a partner who came and they provided the design, the finance, and we contracted with them to actually build the facility. And now the phase we're in is the maintenance. So we can focus completely on patient care. We don't have to worry about the workings of the actual building. For the next 30 years or 29 years now, our partner, Paget Health Services, will be making sure that we are maintained. Any life cycle replacement, whether a floor needs to be replaced or a generator needs to be replaced, all of that will be taken care of by Paget. And what that does for BHB, it allows us to have certainty around what we pay for our building. So there's an annual service payment. We have very clear monthly payments that we can now budget for. And it leaves us free to focus on patient care.
When construction of the new wing began, Bermuda's economy was suffering due to a global recession. As the single largest construction project ever undertaken on island, the hospital was a lifeline for many workers who without this project would have been unemployed. The project was complex, using a lot of new technologically advanced materials and supplies. Designers also incorporated as many environmentally friendly features as possible, and on this first anniversary, the Acute Care Wing has achieved silver status by LEED, the Leaders in Energy and Environmental Design. This achievement makes our acute care wing design a model for hospital developers elsewhere in the world.
It also has solar panels on the roof. At patient levels, we have a roof garden. It's for use by the patients and visitors, and there's benches out there so that they can enjoy the outside when the weather permitting.
A state-of-the-art sewage treatment facility is part of the finished project, leading the way for more organizations to include waste management in their design.
Other key elements of the hospital is actually it has its own sewage treatment plant below ground, which services both the new hospital and the existing hospital. So it'll reduce any environmental impact.
Although the acute care wing required a large-scale design, the architects studied Bermuda architecture and used a view of the island from the water as inspiration for the building design.
The team went out in boats, explored, took hundreds of photographs, looked at how to develop a large building that would suit the Bermudan environment. The majority of the houses are all low-lying, long, thin, they sit beautifully in the landscape, and that was the initial concept for building up the hospital. The eyebrows, as we call them, the deep reveals provided solar shading to the bedrooms.
The building reached substantial completion in June 2014, and BHB received the keys. There was still commissioning work to be done. Staff orientation began that month, and in August, various external stakeholders, including the general public, were given guided tours. In total, 2,165 people toured the new wing before it opened to patients on September 14.
When we brought the public through here for tours, it was overwhelming. They absolutely loved the new facility. Really for me, some of the most memorable moments was dealing with patients that had to deal with dialysis on a weekly basis and taking them through that area. So it was like night and day when you compared the two facilities. And one patient in particular broke down and cried. You know, it was an overwhelming experience for her. Everyone that we brought to this new facility was impressed with the work that went in. The dedication for those that were involved from day one to the final hospital, you know, it was great.
The enthusiasm those early viewers had extended also to patients. The late Eugene Vickers, a pioneer of community education in Bermuda, was the first patient in the new wing.
I feel very comfortable. I have never felt this good in any hospital. I've been a few in my time, but this is really like, it was just wonderful. Oh, the staff has been fantastic. The turnaround is quite smooth, you know. Everybody seems to be working as a real unit, which is great.
Everyone who has worked on this project has contributed to the future well-being of our island home. The opening of the new acute care wing this morning will provide Bermudans for generations to come access to a facility that supports the most modern technology and upholds the highest standards of medical care.
From birth, through illnesses and accidents, to end-of-life care, the hospital's history is built on the shoulders of so many individuals. Its role from birth through the end of life means it is part of so many families' memories. King Edward is truly the people's hospital, providing safe, high-quality, people-centered care for all of us.